students, today's topic or video will be on the gross anatomy of suprarenal glands or adrenal glands. Now, when it comes to gross anatomy, the glands are really simple, short, and easy to learn. But the glands have got lots to itself when it comes to physiology and histology, which you'll be learning in your other classes. So, my advice would be that once you're done watching this video, go through your textbook and finish reading and remembering this topic once and for all. Now we'll be studying this topic under the following headings, namely the general features about the glands, like its measurement, weight, etc. Then we'll see the right and left suprarenal glands separately and in their relations separately. Then we'll learn about the arterial supply, venous supply, and nerve supply of both the glands. And at the end, we'll take up the clinical anatomy related to this topic. Now, for most part of the video or lecture, I'll be referring you through pictures and pictorial representation so that you can have a better idea and understanding of today's topic and you can remember it for most of the time. Now, without further ado, let's begin with today's topic. Now, the adrenal gland or the suprarenal glands are the pair of golden colored endocrine glands which lies above kidney. Now about the location of both the glands. Now both the glands are retroperitoneal and both of them lies in the epigastrium region. Both of them lies at the level of T12 to L1 vertebra. Now about the size, shape and weight of the adrenal glands. Now this is the picture of the adrenal gland and how do they look just before birth. So before birth they are 1/3 of the kidney, but in adult they forms just the 1/30th part of the kidney. Each gland on an average measures 50 millimeter in height, 30 millimeter in breadth and 10 millimeter in thickness, and medulla constitutes 1/10 of the whole gland, and each gland is roughly of 5 gram in weight. The right suprarenal gland, as you can see from the picture, is roughly pyramidal in shape and the left one is semilunar in shape. Now the covering or the sheaths of the suprarenal gland. This is the adrenal gland, which is immediately surrounded by a considerable amount of fatty areolar tissue, and outside this areolar tissue there is a covering of the renal fascia. This is the renal fascia. The gland is separated from the kidney by a septum of connective tissue. Now we will learn about the individual glands, the right one and the left one. First is the right suprarenal gland. As I told you earlier that the right suprarenal gland is triangular in shape. Okay, it has an apex, a base. This one is the anterior surface and this one is the posterior surface, and it has 3 borders. This one is the anterior border, this one is the medial border, and this one is the lateral border. The anterior surface of the right suprarenal gland, by the virtue of anterior border, is divided into medial area and the lateral area. The medial area is just behind the inferior vena cava and the lateral area is just behind the bare area of the liver, and the lowermost limb of the right suprarenal gland is behind the duodenum. The posterior surface is related to the diaphragm. Now the left suprarenal gland. The left suprarenal gland has two ends, the upper end and the lower end. Two borders. This one is the medial border, which you can see is convex, and this one is the lateral border, which is concave. Two surfaces, this one is the anterior surface and this one is the posterior surface. Now the relation of the left suprarenal gland. Anteriorly, it is divided into the upper end and the lower end. The upper end is related to the body of the stomach and the lower end is related to the pancreas. The upper end is also related to the part of the spleen, and again posteriorly the posterior surface is related to the diaphragm, left side of the diaphragm. Now the blood supply of both the glands. Arterial supply of both glands is done by superior suprarenal artery, which is a branch of the inferior phrenic arteries. Then there is middle suprarenal artery, which directly arises from the abdominal aorta. And then there is inferior suprarenal artery, which is a branch of the renal artery. Now the venous drainage. Each gland is drained by one vein, the right one by the right suprarenal vein and the left one by the left suprarenal vein. The right suprarenal vein directly drains into the inferior vena cava and is in very close proximity with the right suprarenal gland. The left one first drains into the left renal vein and then drains into the inferior vena cava. The lymphatic drainage of the adrenal gland is done by the lateral aortic lymph nodes. Each gland drains into the lateral aortic lymph nodes. Now the nerve supply of the adrenal gland. The cortex is endocrine in nature. The cortex of the adrenal gland is endocrine in nature and is controlled by ACTH. But the medulla gets its sympathetic fibers from T8 to L1. The preganglionic fibers crosses the cortex, reaches the medulla up to the chromaffin cells of medulla, which are considered homologous with the postganglionic sympathetic neurons and hence secrete epinephrine and norepinephrine. Now we will talk about some clinical aspect of adrenal glands. The adrenal glands can be represented via computerized tomography or CT scan in two views, the axial view and the coronal view. Here you can see that behind the inferior vena cava there is a slight dark line which is the right suprarenal gland, and just opposite to it this is the left suprarenal gland. In the coronal view you can see that above the right kidney there is right suprarenal gland, above the left there is left suprarenal gland. The next clinical aspect is the Addison disease. Whenever there is insufficiency or decrease in secretion of cortical hormones, maybe due to primary reasons or secondary reasons like tuberculosis, there are myriads of symptoms which are known to as Addison disease. There is, like in this picture, pigmentation of the skin. Also, there could be muscular weakness, low blood pressure, circulatory and renal failure. Likewise, the hypersecretion of cortical hormones can lead to various diseases, one of which is Cushing syndrome. So this is a picture showing various symptoms of a patient suffering from Cushing syndrome. So in Cushing syndrome, what happens that there is hypersecretion of glucocorticoid, which is secreted by the middle layer of the cortex of the adrenal medulla. It gives rise to various symptoms which are known as Cushing syndrome. For example, some of the important symptoms are and signs are central obesity, thin skin, okay. Then there is also red cheeks and hirsutism, diabetes, hypogonadism, etc. Another clinical aspect of adrenal gland is the pheochromocytoma. It is the benign tumor of the suprarenal medulla which leads to increased amount of adrenaline and noradrenaline into the blood, which gives rise to following classical symptoms like high blood pressure, headache and sweating, and these are the other common symptoms. So that was all about the gross anatomy of suprarenal glands or adrenal glands. I hope that you have understood most of the part that I have taught you today. But still, if you have any confusion queries related to it, please feel free to ask them. I would love to answer them. We'll meet in our next video or lecture. Till then, be safe. Thank you.